Good morning, everyone, and welcome to our first Health Services Advisory Committee meeting of the new year. Yay for us. We made it. If you could please put your names in the chat box so that we can make sure that we get you recorded as having attended. Deb, can you give me a thumbs up if you can hear me? Thank you. All right. Thank you, Mara. You can go ahead. You are Martise.
Okay, good morning, everyone. Please make sure that you are muted to avoid any background noise. Of course, if you have any questions, please use the chat box and enjoy the presentation.
Thank you, Martise. And this is our agenda for today. Welcome to everyone. I'm not sure how many people we have invited or registered. Martise, you can tell us that, but I'm sure people will be joining as I see that they're signing up now. But we'll go ahead and get started with our agenda. And so I will do a purpose of the HSAC meeting, why we do these, why it's important, what the structure of the HSAC is going to look like moving forward. And then we'll have vendor presentations. After that, we'll do a little activity of a peer exchange. And then Dr. Sally will close the session for us. So with that, I want to move to the next slide. All right, let's review the purpose of the Health Services Advisory Committee. My name is B. Nichols. If I didn't introduce myself, sorry about that. I am the Director of Children's Services within DFSS. I want to thank you for joining us today. And as you will see, we have a pretty aggressive agenda, so I'm just going to go ahead and work through it. And very excited to be able to introduce you to all of DFSS's health vendors. We call them subject matter experts. And so you will get to meet them in a few minutes. We'll also, as I mentioned earlier, use this time to have a little peer exchange. And then we will share dates with you for the upcoming subcommittee meetings. So the purpose of the HSAC. The purpose of the HSAC is to be able to share all of our health experiences, to review and analyze DFSS's data as it relates to health, and to guide discussions around health, establish goals, find solutions, because we know that there are some health disparities that you as our agencies and families and other stakeholders are experiencing. And so we want to know what those are, and we want to engage in finding solutions to those health disparities. As an example, when we were at the height of the pandemic, DFSS and its agencies really rallied together to take immediate measures to establish health protocols. Many of you are still practicing those health protocols. We distributed PPE and supplies. We provided remote educational services. And we even delivered food to those children and families in need. DFSS was only able to accomplish these feats due to the help of our various stakeholders. As I mentioned earlier, our families, our agencies, our vendors, the policy groups who are invested in what we do. Next slide. So our HSAC really serves as a vehicle and voice to bringing these health concerns to light and to seek solutions. It's important to note that while we're doing this first HSAC of the year virtually, we will be coming into community. So I want to take this opportunity to say that as we move back into hosting in-person meetings, we would love to be able to come into community. So if you have a space that's large enough to accommodate 100 people, about anywhere between 80 and 100 people comfortably, and you have ample convenient parking, please email me. Martise, if you could put my email address in the chat box, I'd appreciate it. So what we're looking at here is the various subject matter experts that participate on the HSAC and in the various subcommittees. You will meet majority of these vendors today. As you know, with our hearing and vision team, it is internal to DFSS, but they will also be involved and participate. Community partners and stakeholders. We see all of our agencies and the program parents as VIP stakeholders, along with some of the city departments that we will be inviting to participate along with us as we work to solve some of these health disparities, and state departments. So now we're going to move into the various HSAC subcommittees. This HSAC, though, I think I mentioned earlier, meets twice a year. We meet in the beginning of the program year like now, and then we will meet again as a large HSAC body at the end of the program year. Okay, next slide. Each of our subcommittees will also meet at a minimum twice a year. And I say at a minimum because once you get into the work of each of these health subcommittees, whichever one you participate in, the work is really what's going to drive the frequency of the meetings. So you can meet more often than twice a year, depending on the work that you need to get accomplished. Each subcommittee will focus primarily on health, okay? But it will do so within the context of its respective discipline. So with this first subcommittee, which is our health subcommittee, you can see who are the participants and leads for this particular subcommittee. And again, you will meet them a little later on. We have our health lead, which is NovaCare, our mental health lead, which is SGA, and our dental oral health care lead, Sunrisa. And then all of our various community partners and stakeholders. And as I mentioned, if you scroll down to the very end of the page, you see the minimum is one meeting in January and one meeting in April before we reconvene with the larger HSAC. Next slide, please. Our next subcommittee is our family and community engagement subcommittee. Again, our lead for this particular subcommittee is UIC, the University of Illinois at Chicago. And they will be reaching out and working with all of our community partners, stakeholders, and again, we'll be meeting at a minimum twice for the year. Next slide. Our last subcommittee is the Education and Disability Subcommittee. And our leads for this subcommittee are Erickson Institute and Teaching Strategies Gold, along with Chicago Public Schools, the Office of Diverse Learners. And as most of you know, we do have a shared team here. So we have the DFSS CPS Disabilities team, and you will meet them a little later on as well. All right. Next slide, please. The other thing that I wanted to mention was that these subcommittees and the HSAC is open to all DFSS agencies, our families, and other community stakeholders. So you're encouraged to participate in one or all three of the subcommittees. It all depends upon your interest. For each subcommittee, there will be a SME lead and co-lead. They will facilitate these meetings. They will set future meeting dates, goals, but none of us, DFSS, nor our SMEs can do this work alone. We really depend on all of you to work along with us. Your participation is vital in moving this work forward. And with that, I am going to introduce you now to DFSS's health lead, which is Dr. Sally Norfor of NovaCare Inc. Dr. Sally, I believe that this is, I think, your second year with us here at DFSS as our health lead. Yeah. And we're very happy and excited to have her expertise. So I'm going to turn the next part of this agenda over to Dr. Sally, who will lead us through meeting our vendors. Dr. Sally.
Thank you, B, and good morning, everyone. Can you hear me okay? All right. So good to see all the faces again, and so good to be part of this body again, something to always look forward to. So on this section of this meeting, I will be introducing the vendors. Just like B said, there is NovaCare Services, and we are over the health support part of it, covering nursing and medical interventions for our delegate agencies, including teachings. There will be others that I'll be introducing as I call them up, but I'm going to start off with what NovaCare does. And with this slide, we've been working with individual delegate agencies to provide health assessment for families, especially with the early Head Start and the mothers that are expecting at home, where we do our prenatal visits and also see them after the babies are born. And we cater to the education both on the delegate agency level to educate their staff and the populations, grassroots, the mothers and their families that we are providing services to. And I'm going to deviate a little bit on this slide this morning to say that our services really has been underutilized. And probably we know that COVID was part of it, but we are coming out of that COVID now. And we want to make sure that everybody knows that these services are available, all for the asking. Now, we've been working with specific delegate agencies, but there are a whole lot of them out there that can benefit from what we do. So I'll go through these services. Please feel free to email me. There'll be our contact information on the next slide. We want to make sure that everybody gets an opportunity to access our services. And any questions that can come up, we can deal with. We've had questions about completing children's physical, where the primary physicians are not able to do that. We've had to tackle blood draws for physicals for the children, educating the mothers from lactation to hygiene issues to prenatal and postnatal education. So these services are available. We have Dr. Richardson, our medical director, working with us. We also have the program director, Ify, that's with us. And if you reach out to myself or Ify, your needs will be met within the context of the services that we're providing. Next slide, please. So NovaCare Services is the health support service provider for the county public health initiative that B has explained. We inform, we educate, we empower parents and the delegate agency workers, thereby reaching the community as a whole in peculiar health issues that are within our confines to be able to take care of. Next slide, please. So in conforming with what the vision is for DFSS, We want to partner with every delegate agency out there, partner with other healthcare providers in order to solve those problems that we have identified as affecting the community that we are serving, especially those that we don't have to look extra mile to get, that are within our confines to do. We should be able to tackle it, but we need to know that those services are needed by the agencies. And the way we got to know about it is if they reach out to us. Initially, when we started, we took time to contact every agency we had on our list. Unfortunately, most of the agencies haven't even heard about Novacure or heard about that service is available. Some of them will hang up and goes, I don't know what you're talking about. Some of them will go, who's paying for these services? So we spend time to explain that. So pass this information along that Novacare services will do your parents teaching training, who will do your agency training, anything from universal precaution to COVID related, especially now that we're going into the flu season. We'll be glad to also do your flu education to encourage your staff to get vaccinated. And in other words, they can also pass that on to the families. If there's any family gathering, whether online, that you want us to talk about the flu vaccination, but for all the family members, not just for kids, to encourage compliance, we'll be able to do that, because if one person gets the flu, chances are someone else is going to get it in the family, and then they go out to the community and somebody passes it on. At the end of the day, something that could have prevented, but with education ends up being a big deal, because families are now sick and the community are going through difficulty. Next slide, please. So our nurses, when you contact us that you have the pregnant women that you're enrolled in the program, it doesn't matter what trimester they are on. Could be the first trimester, second or third. Ideally, we'd like to get them when they're in their first or second trimester. That way we see them before the baby comes and also see them after the baby comes. But even if you enroll them and they are 2 weeks to go, still contact us. If we are not able to see them, if you're not able to contact us and you enroll them and boom, the baby comes, still let us know so that we can catch some aspect of, especially for the new mothers or the young mothers that have not gone through that track before, they can use the resources that we have to offer and little extra help in addition to what they are getting in their prenatal visits to the hospital. So delegate staff education, like I mentioned, just a few here, universal precaution, OSHA, hand washing, febrile seizure, we've done toileting, we've done safety, emergency training, lactation training. So it's not limited to all of this. If there's any other topic you want us to handle, we'll provide that for you, for your staff, and also for parents if you need to have them trained. Next slide, please. Part of what we also do is develop policies. Unfortunately, we haven't been able to do this with any of the agencies because the requests have not been made. We write policies, we develop these policies, the health policies we develop in conjunction and in collaboration with our medical team, and also the community health policies we can develop here. We've been doing that for years. It's an additional service that we can partner with your agency to tailor it down to what you have, especially like emergency policies. You're supposed to have that in place, exposure policies in place. What do I do when my staff is exposed? Something has to be in place so they know what to do. That way they are covered. What do I do if there's an emergency healthcare? Where do we start CPR? What do they do? CPR classes. We offer all that. Just reach out to us and we'll be able to get that done for your facility. We also partner with the early childhood facilities for the intake and the annual physical. That we need to work with our physician, make our time to come to your location. If your family member, if your family clients are not able to get to her office, we can plan to come out to your office. Just get us a date, get the families together so that we know exactly how many people we're anticipating to be able to prepare to accommodate that population when we come out there. Next slide, please. So our service model is to access, and when we access them, we're using the information that we gather the information also that's being given to us from what the city is gathering as to what is going on in the population, information from IDPH, CDC, to be able to determine where do we focus our teaching, where do we focus the resources we have to offer the families, what is the trend that's going on. There was a time smallpox came out again. We have tuberculosis. These things can become an epidemic if we don't handle them right. And thank God we already have protocols in place for those. It's not like COVID that just hit us out of nowhere. And right now also, even though COVID caught us unawares, there are protocols in place to handle COVID. And just in line of that, I just want to throw this out there that another thing we are seeing right now with the children's population is RSV. And RSV will come out looking like either it's a flu or maybe COVID. Some kids actually, it looks like it's an asthma attack. They'll do COVID is negative. Some hospital might say, oh, there's no COVID, go home. RSV, it's a virus, it's self-limiting, it dies in 14 days, but it can also kill within that 14 days. So that child needs supportive care, it needs febrile control, needs hydration, needs palliative care to make sure that, so it's going on right now, even when we haven't even hit fully the flu season. So watch out for that population, especially those that the daycares are still open. Bad thing about RSV is highly contagious. It is airborne, it's droplets, you cough, they get it. It starts off a fever and then there's difficulty breathing. And if any of your children in your facility start exhibiting that symptom, please continue your isolation and mask protocol, get that kid to the hospital so that they can rule out RSV. So back to our service model, we communicate, we keep agencies and our communities informed on education, just like what I communicated with us now. And we are open to connect with any recipient of our services to make sure that our services are well utilized. If there's any other way we can use to publicize what we do, please feel free, put it on the chart. That way we know avenues we have not access to be able to get our services information out there, to be able to service as many agencies and as many people, families that we will be able to service. So education, health screening, immunization are top of on our list. Both the boosters that are coming on for the adults, the COVID vaccination for the children. We still have parents saying, is it safe? Is it not safe? There's a lot of education on that part to boost their confidence to be able to get their children protected through immunization, in addition to the rest of the immunization that are going on there. And pretty much that is the end of my presentation. And going forward, I would like to call on Dr. Kokos from Sonrisa to tell us more about the dental services that they are providing. If you have any comments, questions, put on the side, we'll address all of that. Thank you. Dr. Kokos?
Yeah, I believe he may be having a little trouble joining us. Maybe we can move to the next presentation and come back. Martise, can you move to the next vendor?
Hey, B, I'm moving to it right now.
We can call on SGA. Melissa, you want to tell us about mental health while we wait for the family dental to come on?
Sure, I'm here. Good morning, everyone.
Good morning, Melissa. Nice to see you again.
You as well. Thank you so much. So my name is Melissa Moore, and I'm from SGA Youth and Family Services. And just a little bit about SGA. This is an infographic up here that showcases our scope of work. I don't expect that you can read it, but I just wanted to showcase our services in creating a cycle of opportunity. We can go to the next slide. Our mission at SGA is to help children, families, and communities facing great challenges to realize their potential. And our vision at SGA is to transform challenged neighborhoods in the greater Chicago area into healthy communities. We can go to the next slide. And so today we're going to talk about mental health services. This comes straight from the cells, but I think it really helps us to frame a definition around mental health. And I'm just going to read it out loud. It refers to the practices and conditions required to support children, their families, and staff social and emotional well-being. And I want to underscore the staff part because we know that we're in the work to help support children, but in order to do that, we need to support the caregivers that help to support the young children in that work, and promote healthy relationships that are the foundations of children's learning. Mental health services are designed to assist children in their emotional, cognitive, and social development toward an overall goal of social competence and school readiness. Next slide, please. Also pulled from the cells, we know that we have certain aims that we hope to achieve within mental health. It's an important piece of early childhood development and housed really naturally in health services. And some of the direct supports that we offer to children, parents, and staff include a myriad of things, but assisting children in their emotional, cognitive, and social development, assisting parents, staff, and caregivers in developing positive attitudes towards mental health services, which can be, a pretty big barrier at times. So how can we help folks understand what mental health encompasses and the range of supports and services that are available within that? We also aim to provide parents, staff, and caregivers with an understanding of child development, child growth, and how that intersects with their growing capacity for social emotional development. It provides prevention, early identification, and intervention for things that might interfere with child and family social functioning and within their relationships. We also know that we intersect with families who are engaging in IEP and IFSP plans, so supporting parents and staff and through supporting their children and implementing the goals of those plans. We also provide children with disabilities and their families with mental health support. So again, supporting those IFSPs and IEP developed plans. And then providing assistance and intervention to families and staff who may find themselves in crisis. Next slide, please. And so what I also included here is some information about the Illinois model for infant and early childhood mental health consultation. I think the first bullet point up here really summarizes some important and key points in that what we know is that access to early childhood mental health consultation can reduce preschool expulsion, something that I know is really important to all of us here. It can improve parent-child relationships. It can increase the development of positive social skills and support the quality of the workforce by increasing retention rates of early childhood professionals, something that I know we've all contended with, especially throughout the pandemic. And what this model does is it pairs an early childhood mental health professional with the systems, classrooms, teachers, families, and children in across the body of the work that we do. It really sort of puts at the forefront that social emotional development is the foundation for all learning, and supporting those strong relationships is key, again, with families, within systems, within classrooms, and really supporting it at all levels. Next slide, please. I also just included a nice little visual from 0 to 3, which I really like. And I think the key point here is that while social emotional development naturally falls in the early childhood sector, it really is important that promotion of early childhood mental health cross sectors. So it's in pediatric care, it's in home visiting, it's in our judicial system, it's in policy making, child welfare, as well as in early intervention. Next slide. So what does mental health services look like? This is basically the scope, but essentially, I think starting off with a strong idea of planning. So developing those plans within your program, creating the outline, sort of the roadmap. How are we going to build the relationships? What services and supports are we going to put within our program? It's supporting the parent orientation to introduce mental health services so families understand what that language means and what services and supports are available to them and how to access them. Of course, it's parent and staff education and training. It could be general classroom observations with feedback meetings to the teachers, social emotional support with those IFSP and IEPs. It could include individual child observations, parent consultations, as well as crisis intervention. Next slide, please. And then my contact information is here, but essentially reaching out regarding promoting children's intellectual, emotional, and social development. Of course, nurturing those very important relationships. It can include kind of doing some brainstorming and some searching across the community for what are the mental health and counseling resources that are available. And of course, considering and thinking pretty deeply about wellness across our programs. And thank you so much.
Thank you, Melissa. Quite detailed. Thank you so much. Do we have Dr. Kokusan already? If not, whenever you're ready, Dr. Kokus, just put it on the chat that you're ready. And I believe B's monitoring the chat room. We can go on to Erickson Institute. We have Shelby. Shelby, are you on?
Yes, I am. Thank you, Dr. Sally.
Thank you.
My name is Shelby. I work with Erickson Institute, and we work with your 0 to 3 kiddos as disability subject matter experts. So I have 4 members on my team, including myself currently, and then we are hiring a 5th person. We have Latoya, Zakia, Pam, and then myself. Next slide. Our program goals are really to help early Head Start teachers identify children who may have a learning difference and work with early Head Start staff to make sure those kiddos are receiving referrals or support in the classroom, whether that's a referral to early intervention or a referral to Chicago Public Schools as our kiddos get closer to that 3-year age mark. We work with teachers and early Head Start staff to provide training and technical assistance and support kiddos with suspected or confirmed disabilities. Next slide. We support all 25 of the early Head Start agencies in the city of, or that are contracted with DFSS in the city of Chicago. You can go to the next slide. I also wanted to provide a little breakdown here of all of the sites that each individual subject matter expert supports. So if you have any questions and you see your agency name there, you can please feel free to reach out to your subject matter expert via email. We are here to support you in all of your 0 to 3 disability needs, whether that's individual observations with a kiddo, classroom observations with your DFSS sites, any sort of training. We are happy to provide that for you in your 0 to 3 kiddos. Next slide. Here is a list of trainings that we can offer and we do provide in addition to some others. If you have any specific needs, you can please feel free once again to reach out to your SME and we will do our absolute best to accommodate you in those needs. But we currently offer the ASQ3, the ASQ SE, a training on early intervention and the DFSS referral process, a training on communicating with families and discussing sensitive topics like concerns that their child may have a learning difference, how to individualize in a classroom setting for children with disabilities, and what does normal kind of typical development look like for our 0 to 3 kiddos. Technical assistance that we can offer is reviewing your ASQ scores, doing classroom observations, individualizing lesson plans and individual observations with specific children that you may have concerns about. We can share knowledge on what is developmentally appropriate for kiddos in a certain age group in the classroom setting. And we can also help your staff model and coach skills to your classrooms and your teachers. So this, once again, comes directly from the cells as well, but as an early Head Start site, we're mandated to provide enrollment to eligible children with disabilities, and we aim for the goal of having 10% of your total kiddos having a disability or having a learning difference. And we want to ensure that children of all learning abilities and any sort of diagnoses have access to high quality, equitable services. So our program works really well and kind of similar goals to what the mental health consultants do, and that we want to support you and make sure that we are finding the babies that are in need of service and supporting them and supporting the teachers and making sure that they all have access to high quality education. We want to ensure that children are receiving timely services. I have heard from almost everyone that the CFCs are really behind right now. And if you are having difficulties getting a hold of an IFSP for a kiddo, if you're having difficulties finding a service coordinator or getting in contact with your service coordinator, we would love to help you get any of that or to make those connections. We have contact information and we would be happy to share it with you or be happy to coordinate those emails to make sure all of our kiddos' needs are being met and that there's no delay in services or as much as a delay as we can minimize. And we also want to help ensure that children transition smoothly from EHS to CPS and that there's no lapse in service or delays in getting our kiddos transitioned to their next school system. Next slide. I did see a message in the chat. Yes, yes, of course. If anyone else has any questions, please feel free to let me know. Otherwise, thank you all. If it's nice being here with you all.
Thank you, Shelby. Matisse, can you please go back to the slide where she has who is visiting which are the agencies? Thank you. That slide, if you can keep that for just a second so that people can also look through it.
I would also be happy to email this out to anyone as well if it's needed. The sites have been having individual contact with their agencies, but if anyone is in need of that like big picture view, I would be happy to make sure that you all have access to that so you're not trying to scribble frantically.
Great. Thank you, Shelby. Thank you so much. I appreciate all you do. So we have Sarissa is ready and we have Ellie. Ellie, are you ready? Hello, Ellie, for Dr. Caucus from Dental. Okay. We'll still give them some time.
She's trying to unmute, I believe.
Okay, I see her really trying, but it looks like she's unmuted.
Hello?
Hey, Ellie, we can hear you.
Okay, awesome. Great. Good morning, everyone.
Good morning.
I am so glad I was able to jump on here. The audio actually works. I am from Sonrisa Family Dental. Dr. Corcus unfortunately wasn't able to make it today, but we can definitely go ahead and talk about our program. I don't know if the PowerPoint, if somebody can bring the PowerPoint up. Perfect. Awesome. As mentioned, I'm from Sonrisa Family Dental. The first slide you will see our team. We have a slogan saying healthy smiles mean healthy communities, and that's really what we want to reach out and make sure we reach out to all the communities and make sure adults and children are having a healthy smile. We can move on to the next slide. Some of our services that we offer all services under general, which is same-day emergency treatment. Now, we do see or work with adults and children. Cancer screenings, all this is for adults and children. We can go on to the next slide. And this is our school-based program where we go out to the sites, Head Start, Early Head Start, and we serve the children with preventative service such as the exam, the cleaning, the fluoride, oral education for the staff, for the parents, and really educating them on the importance of dental health and the importance of taking our children to the dentist, the importance of us as adults visiting the dentist. We can go on to the second slide. Oral health education is really something we like to focus on. And we have many topics such as pregnancy, what happens during pregnancy, with our teeth, heart disease, cancer, baby bottle decay, which is still a concerning cost to this day. We can go on to the second slide. A big thing we also like to focus on is case management. We will help your families find dental homes. It doesn't necessarily have to be Sonrisa. Sonrisa has 11 locations throughout Chicago. However, if Sonrisa is not close to one of the locations where your family lives, we will definitely help find a dental home near them. We want to follow up with any dental treatment that we might see when we go out to the site. We know that getting that dental exam is not too much of a trouble, but really completing the dental treatment can be of a trouble, with, especially if the parents have to leave work. So we try to really have appointments, like same-day appointments, weekend appointments. You can see the locations that we have throughout Chicago, as well as our contact information. If you do have a site that there's a number of students that haven't completed their dental, please feel free to reach out. We go out to the site to provide the dental services in the site. So we provide sedation for children with special needs. We provide the nitrous gas, which is not complete sedation. They're still awake, but they just feel more relaxed. We do not provide any sedation that completely sleeps the children. Any other questions? Here we can see more of the topics of workshops. Now we can definitely accommodate whatever topic your site would like to talk more about. If you have, again, a number of parents who are expecting or moms who are expecting, we would like to talk about that. Or if your site has quite a few numbers of students who need to complete treatment, we will talk about that. We can go on to the next slide. Here are some of the most common causes we see at the sites. One would be access. We see a lot of students with access. Unfortunately, the parents don't always notice a child might have an abscess. If they fall and trip, they don't necessarily feel pain right away. But if you do notice your child, their cheek is getting bigger, it's a sign to take them to the dentist as soon as possible. Especially if their cheek is getting inflamed. Abscesses tend to travel quickly in the little ones, and their body is much smaller. You can go on to the next slide. Tongue tie, that's something we look for when we go out to do dental exams. We can go on to the next slide. It's nothing dangerous. However, if left untreated, in some cases it can intervene with speaking. So we definitely would follow up with the parents if we see that. Dental cavities, of course, especially baby bottle decay. Many parents believe, well, do we really need to take care of the cavities if their teeth are going to fall off anyway? Well, definitely we do, because the adult teeth are right on top of the baby teeth. So if the decay is very big, it definitely can move on to the adult teeth even before it erupts. So we definitely want to take care of that. Open bites, we see that quite a lot from the thumbs or from the pacifier. And if it's something that's not corrected, even though the child might get older and not necessarily suck the thumb anymore, the thumb is replaced with the tongue, and it still has that open bite. So that's something we would like to correct as soon as possible. And if it's something that's persistent, then we can talk about if the child needs surgery as they get older. Gingivitis. Now this is we see more with adults. Gingivitis, that's you can see the line of the gum inflamed and red. You see that white fuzzy stuff. That is we can easily treat. We just clean. with us every 6-month cleanup, that can definitely be treated. However, if it's left untreated, especially in adults, it becomes a more of an advanced problem, and that's when it becomes periodontitis. Unfortunately, when it reaches that level, it cannot be cured anymore. We can just slow down the process of your bone receding. We can move on to the next slide. Again, periodontitis, we see this a lot with adults, especially if they haven't seen the dentist in a while, or if they're told you need a deep cleaning, but no treatment is done. That's where we see a lot of the bone receding. And then we can go on to the next slide. I don't think the video might work, so we can go on to the next slide. Yeah. And again, here are our locations. And we definitely offer appointments for the families, for the children and parents. We want to make sure parents are also seeing the dentist. There's been cases where we go out to the sites, we ask the children if they brush their teeth at home. And we are surprised at the number of students who say they don't. And when asked why, they say, well, my parents don't brush their teeth, or I never see mommy, or I never see daddy brush their teeth. So we definitely also want to make sure parents are seeing the dentist. And again, all of our locations work with adult and children and take all types of insurance. You'll see our contact information if anybody would like to reach out or has any questions. And I thank everyone for your time.
Okay, there are some questions on the chat room, Ellie. If you can also take a look at the questions that are directed to your services. It says Joshua Kresnik says, does dental provide sedation for children with special needs, behavioral related issues?
We do not provide full sedation. We provide nitrous gas, or known as the laughing gas, where the child is still awake, but they just feel more relaxed. And we do work with students with behavioral related issues. Yes.
Okay. And Matthias, Karen is asking, can you go back to the services provided, the slides that have their services one more time?
Yes. I believe it should be like the 4th or 5th slide. There we go. Yeah, so those are the preventative service we offer, or we treat the children with. We do the dental exam for every child, the cleaning, the fluoride treatment. Now, if parents don't want their child to receive fluoride, they can definitely opt out of that. Sealants, if they have their adult molars in, we'll definitely go ahead and put a sealant on that helps prevent cavities. And every student definitely goes home with a toothbrush and toothpaste.
Okay, the slides with the parent workshop, she said she wants to see.
Yes.
Right there.
Yes, so these are some of the workshops. If there's something on the list that you would like to have for your site and it's not there, definitely let us know. We want to make sure we are catering to every site. Every site might have different needs, so we want to make sure we are educating with different topics.
Thank you so much, Ellie. Glad you were able to come on. Information quite useful, something we can also use. And as we all partner to achieve the goals that have been set to benefit the communities, we all agree that parents' involvement is key. We need to get the parents to buy into what we are offering by showing them how it benefits them and their families, and how easy it is to access these services. So to talk to us more about parent engagement, we're going to call on UIC. Not sure who's representing UIC.
Good morning, everyone. If you could actually go back to the other slide first. Beautiful. So Again, good morning. My name is Joshua Krasny. I am the Assistant Director at the Resource Center for Autism and Developmental Delays, which is part of UIC's College of Education, specifically falling under the umbrella of the Center for Literacy. I am also acting as the Interim Associate Director for the Center for Literacy. We recently did have to say goodbye to our formal director, and it's been a bit of a struggle to say the least. For those of you who are familiar with the Center for Literacy and the services that we have always been able to offer, there has been a significant change specific to our grant and the funding and the scope in which we are focusing our efforts specific to those new deliverables. And what that is really going to encompass is more of a train the trainer model, and that is going to be directed at all early Head Start, and Chicago early learning sites who may be receiving DFSS funding. There are certainly some sites that do not fall into that category because they don't, but sites that do receive DFSS funding will still fall under the purview of our training opportunities. What you see here in front of you is a list of the trainings that we are currently offering to all of those previously mentioned sites. I'm not going to read through each and every one of them, but just a brief overview. There's the Parent Education and Employment Readiness workshops. There's the FLIP, or the Financial Literacy Initiative workshops. There's FLAME, the Family Literacy Training workshops. There's 24/7 Dads, which is really meant to promote male involvement. There's ERTP, which again is Employment Readiness, Digital Literacy, and then Read, Make, Play, which is actually a research-based model. And that, in fact, does incorporate parents. That's a 12-week course where parents will work with trainers, I believe one time weekly, maybe 2 times weekly, to learn literacy-based skills to then work with their children. So for those of you, again, that are familiar with our previous service model where we were very engaged in working directly with the parents, we're seeing a rather significant pivot in what we are now funded to provide. And again, that is the trainer-trainer model, and the anticipated outcome there is educators will come to us, center and school staff will come to us. We will provide trainings that they in turn can bring back to their sites and not only train their staff, but also train their parents as well. Now, the reality is, and I'm sure that a lot of us on this call are in the same boat, over the past 2 years, we found ourselves having to pivot much more so into a digital or a virtual format of delivering our service content. Unbeknown to us at the time, that really prepared us quite well for the new grant and the new deliverables that we were being tasked to provide. The truth of the matter is that over the past 2 years, by offering these virtual and digital-based trainings, we saw a significant increase in those that were in fact attending our trainings. There's obviously something to be said about meeting in person, but at the end of the day, it's about how many people you can actually reach and impact. That's not to say that we are not looking at venturing back into the community. That is absolutely something that's on our radar, but we are really focusing on maintaining those adjustments that were made during COVID and turning them into a permanent fixture within the CFL workshop model. If you can now go to the next slide, that'd be great. So specific to everything I just said, there is one caveat, and that caveat would be the Resource Center for Autism and Developmental Delays. The Resource Center for Autism and Developmental Delays, or otherwise known as RCAD, has 2 locations. We are located at 43rd and Cottage Grove in the King Community Center, and we are located at 10 South Kedzie in the Garfield Community Center. Both of these centers function in 4 different capacities. So you will find at both centers resources, referrals, visual supports, training opportunities, and I guess 5, legal advocacy. So under the scope of resources, what you'll find at both locations are a lending library of sorts, where all of the material is very specifically curated to identify those areas of content that we might see in an IEP as it relates to a child with autism or developmental delay. Again, just like any library, you'd be able to come in, you'd be able to work with a staff member, identify what content area you're looking to address, and then we would provide you with materials to do that. And that can be language development, that can be sensory processing, that can be social emotional. It can certainly be math, reading, or science, or just general imaginative play. There are roughly about 3,000 different items at both locations that can be checked out in that respect. There are also, there's a plethora of both clinical and children's books that are going to be available to you as an educator or for the parents that you serve to better equip themselves with strategies. And then there are going to be children's books as well that are primarily going to focus on some of the challenging areas that relate to autism and developmental delays. Probably the most pertinent aspect to what we do is the creation, formulation, and dissemination of curriculum. And when I say curriculum, what I'm really referring to are those visual supports that children with autism, who are primarily visual learners, need to learn and progress and meet academic, social, and leisure goals. We have a plethora of materials that can simply be accessed, and we also will work with clients to create tailor-made curriculum. So what I mean by that, I mean if we have an individual that's working on a particular subject matter that's a particular challenge, we will try to dissect where that challenge lies and create material that's not only going to address that, but that's going to offer some interest to the individual. We want to give that individual ownership over the material in order to make it that much more digestible and hopefully produce that positive outcome. And then we offer trainings. There is a list right here of the trainings for the remainder of the year. We offer trainings both in English as well as Spanish. What you're not seeing here are our Understanding Autism training, which is essentially a 101. It's maybe geared towards a family or a teacher or an educator or a professional of some sort who is just entering into the field working with children with autism. It could also very well be a refresher course. We have a Tips and Tools for Homes and Schools course, which identifies why we use visual supports, what they're meant to do, what they're meant to accomplish, and then we talk about the ways in which we go about creating them, and then the structure involved in facilitating their use. We do offer a social emotional workshop. We do offer a social narratives workshop. Social narratives is another word for social stories. Social story is a component that we use quite often to either introduce something new to a student or child, or to address something that may be getting in the way of that student or child's progress. So it could be a sibling on the way, it could be a death in the family, or it could be a challenging behavior that's standing in the way of their progress. And then finally, we will do IEP advocacy specific to those children who have an ASD, which is an autism spectrum disorder, or a developmental delay identified within their IEP. In many cases, parents will receive that IEP and won't necessarily know how to make heads or tails of it. What we will do is sit down with them. We will go over those benchmark goals. We will go over the data, the percentages, how it is supposed to be categorized, and what their rights, quite frankly, are in relationship to the IEP, and understanding how it's being administered, how those goals and those means of achieving those goals are being distributed throughout the classroom. It looks as though there's also indication here that there is a $100 stipend for a 3-hour training for parents and caregivers. That's specific to the Employment Readiness Training Program. That is not specific to RCAD. I think that about covers it. I just want to end by saying that regardless of the pivot that the Center for Literacy is currently undergoing, we have a 20-plus year relationship with the Department of Family and Support Services as well as the city. So we are very well versed in this process. There's some unfortunate aspects to this that our efforts will not be focused on the parents as much as they will be the educators, whereas once upon a time it was both. That being said, our history and expertise in the field is really going to allow us to move seamlessly into the new directive of our current grant. So with that, if there are any questions, I'd be happy to answer, and I thank you very much for your time.
Thank you, Mr. Kresney. Thank you for your time and the information. Really appreciate you joining us today.
Sure.
And there are some information that's posted on there also for everyone about their schedule and how to reach them. So hopefully we all get to use that. Thank you so much. So we're going to call on Deb Zapalik for teaching strategies. Deb, are you online?
I am, Sally. Thank you.
Thank you.
Good morning. I find it really hard attending a Monday meeting with the weather being so glorious outside, because we all know, living in Chicago, this is not going to last long. Again, my name is Deb Zapalik, and I am a professional development trainer from Teaching Strategy, who works exclusively with Chicago and all the programs that DFSS funds. Teaching Strategies and the department have had a 15-year partnership. And this partnership has really been around support to all of the programs in curriculum implementation for all program options, implementation of the assessment, which is gold, and also support around family engagement, professional development, and the analysis of child outcome data to ensure that each program is aligned to the needs of the children and families in their community. All programs that are funded by DFSS have access to all the features I'm going to review, as well as all program options: family childcare, home visiting, 0 to 3, and 3 to 5. Today, in the universe of early childhood, there are many disconnected resources and tools. There's resources for screening, there's resources for family engagement, there's resources for child assessment and curriculum, health curriculums, and they all seem disjointed. And it almost makes the teacher's job impossible to really provide a cohesive, smooth planning process to ensure that children's growth and development is supported. Next slide. So, what makes Teaching Strategies unique? It's what they call an ecosystem. And what I mean by that is that all the pieces, the planning, the assessment, the family engagement, the reporting and analysis of child outcome data, the professional development, is all connected under one platform. There's no visiting another platform to get information. It's all under one house. And it really supports teachers and families to identify what each child needs and how to support each child's development. Next slide. So my Teaching Strategies is a single entry point for all of Teaching Strategies' digital resources. And as some of the other vendors commented on, we all had to pivot when the pandemic hit. And one of the unique things that Teaching Strategies did was really convert its curriculum into a digital platform where teachers could interact with families in a virtual way and share at-home activities. The platform is designed for administrators, teachers, and families. It's not just for teachers. It's one place to assess using the gold assessment, to plan by using the teach functionality, and to communicate with families through the family app and the Ready Rosie parent engagement curriculum. The digital library includes all the studies for 3 to 5 as well as for 2, all the children's books that can be shared with families, the intentional teaching cards and Mighty Minutes, and the at-home learning games. It's optimized for tablet devices, and there is a suite of reports to support the work that teachers do as well as administrators. There is an expanded online professional development area that includes the hub and the quorum. And I'll talk a little bit more about that. And I was wondering if I could share my screen, if that's possible. Awesome. I'm kind of a visual person, and excuse me. I think what helps is to see what is this ecosystem. And if we look here, I'm actually on the home page. And if you look across the top, you see different icons, and under each is the functions that happens within that icon. So I mentioned how Teaching Strategies pivoted during the pandemic in the creation of the library. And when a teacher clicks on this, what actually appears is all of the curriculum volumes. One of the things we learned during the pandemic is when teachers were at home, they did not have access to their curriculum volumes. They didn't have access to their teaching guides. They didn't have access to the books to read to children. And so what was able to happen for teachers during this particular time with the pandemic, when we were all at home doing virtual, they could actually use the library. The next area is the teach area, where teachers can go in and plan for the different parts of the day using the studies. And one of the unique features here is you can see right here for this small group experience, you see a little icon with 2 people. And if I click on that as a teacher, I can actually share that small group experience with all of the children, or I can choose to share with just one of the children's families. The assess area is where the gold assessment lives. And here you see something called at a glance. And teachers use this at a glance as a way to ensure that they're observing children, reflecting on what they've observed, so then they can plan an individualized learning. It's also where teachers go to finalize their data. The next area is the develop, where teachers can actually go in and put together their own professional development plan. There's also a suite of reports, and the suite of reports are used both by teachers and administrators, where administrators and teachers can actually aggregate data and then analyze it and align the curriculum implementation for their program to meet the needs of the families and children in their community. The family tab is where teachers can invite families. They can communicate with families via text or email. Teachers can share announcements, and they can also, parents can also share with teachers. There's also a library available for teachers to send at-home activities. And there's also the Ready Rosie curriculum available under the Family tab. Any questions? And again, I can stop sharing. Any questions in regards to my teaching strategies? The City of Chicago pays for all DFS programs that are funded through the city, and all of the resources that I just shared are available to all programs. If you're not sure if your program has access, please email me or your SSC, and I can ensure that the resources get turned on for your programs. And thank you.
Thank you, Deb. Thank you so much. Please, if you have any questions, even if after she's done, you could put it on the chat room and we'll be able to address that before the meeting is over. Lastly, we're going to call on CPS, and we have the wonderful SME that's representing Kerry today. So we don't know who that wonderful person is, but we are willing and ready to hear from you. CPS, please.
Very good. Good morning, everyone. Good morning, Dr. Sally. I like you. You're a good hype person. I have to keep you on my rotation. I am Andrea Turner, and I am one of the subject matter experts. And I will introduce the other members of the team in a second. I wanted Ellie to know the reason I went off camera was she really presented a good presentation, and I'm not a dentist person, so all the teeth, I was like, ooh, ah. So I decided to take my face off so you all wouldn't see me screaming. Okay, a little history about the DFSS Early Learning Head Start program is that it was designed to provide services and support to children with suspected and identified disabilities and their families. And so based on that, a memorandum of agreement was created, and the subject matter expert team was created, the disability team, in order to help them fulfill those goals and outcomes. Next slide, please. We have had some transition this year. We went from a team of 8 that included 3 speech pathologists, 3 certified special education teachers, a social worker, a team facilitator, and an administrative assistant. Just Last month, we are not, no, we're still on it. Just last month, we're now a team of 3 with a certified special education teacher, which is Miss Nancy Millsap Thompson. And I'll let Nancy say hello to everybody.
Hello, everybody. We look forward to working and supporting you. Hi.
I am the licensed speech language pathologist on the team, and I'm Andrea Turner. And we have an administrative assistant, Marisol Calde. So our team is small but mighty, and we're up for the challenge of this program year. Next slide, please. Even though we've been reduced, this team will continue to ensure that all children with disabilities are fully included and their educational needs are met, that they are being served in accordance with IDEA, Head Start, and the Chicago Early Learning requirements. And any child that's suspected of a disability is referred, and they're referred based on quality data. Next slide, please. The team also serves as a liaison between DFSS, CPS, and the Office of Diverse Learner Support Services. And we provide technical assistance, training, and support. Next slide. The team also provides individual child observation and classroom observation. Next slide. We also review all referrals that come in for evaluation to the Chicago Public School or the LEA to make sure that they are appropriate. Once we look over those referrals, then we submit them to Chicago Public School for registration and scheduling for an evaluation. Another hat that we wear is that we provide training to DFSS and the sales staff regarding the screening tools, which are the ECR, the ASQSE, and the ASQ3, the training on referrals for evaluation, and any other training that may be needed based on a child's early childhood special education disabilities or related topics. Next slide, please. We also monitor the referral process to make sure that the children are evaluated in a timely manner. And we facilitate that by making sure the parents are aware of the date of the evaluation, and we assist the agencies in helping the parents get to those appointments and have what they need for the evaluation. Next slide. The team also, if the parent would like, can participate in the evaluation. A lot of times we're there for support for the parents and for the disability service coordinators. And we also help CPS sometimes understanding why we may have evaluated a child. We also provide support for CPS, DFSS, and the families when it comes to evaluations, the referral, understanding what evaluation is, understanding what referrals are, making sure the parent and the school understands the different types of service delivery, what a school assignment is, how they get it, and transportation and how they can obtain transportation. And I know this last year we've had some problems with transportation and a little starting this year. We also work with the Erickson team, and she talked about that earlier, in the transition to CPS. Next slide. We also assist in the recruitment of children with disabilities and those transitioning from the Head Start program to kindergarten. And this year, we're also asking that any child that has been screened within the first 45 days and are found to need an evaluation by the local education agency, that they that their paperwork is submitted by November 18th, 2022. What we find is the sooner that the referral packets are submitted, the sooner the children are evaluated and are assigned schools and get their services. That's what we really want, is to have our children get the services that they are eligible for as soon as possible. Just as a side note, this Friday, Nancy and I will be be providing referral process training so that if anyone in your agency needs that, please, I don't know how we do it now, B, you may have to help me, that COPE is down, but if you need it, we'll try to figure out how to get you on. Are there any questions? Let's see, very good. They saved the best for last, no questions. I love it. Everyone have a great day.
Andrea, I do want to add one thing is that
Okay.
we will be diligently working with the DFSS Education and Disability personnel to monitor and assist programs who need extra support. So that's going to be our focus this year. We will be working closely with our education and disability monitors to assist our programs.
Thank you, Nancy. Thank you, Andrea, so much. You guys tag teamed it together. That's why you're called the wonderful SMEs.
Thank you.
All right, so we're going to go into activity now, and I'm going to turn it over to B to take us through the activity in another 10 minutes or so, and we'll be rounding up. Thank you for your patience and focus. We're making progress. B?
Thank you, Dr. Sally. Thank you to all of our wonderful vendors. Those were great presentations. All right, so I want us to get maybe about 10 minutes or so. We're going to break you all off into small groups. And this is the question that we're going to address. How is your program using assessment data to individualize for children? You may want to take a picture of this because we lose this screen once we break it up. So write it down, take a picture, whatever works for you. And we're going to spend 10 minutes in our sessions, and then we're going to come back and discuss this and share in a large group. Okay? See you in 10 minutes. Martise.
Dee, I think you're muted.
So sorry, everyone. I was just running my mouth. Wanted to thank everyone for being in the group, in the individual group sessions. I hope you found it beneficial. And I'm just going to open it up for you to share with us what came out of those group sessions. And I'm looking to the vendors to also add some comments. I know Deb and I, this is a place where Deb, Shelby, and I have really had a lot of deep conversation. And so we thought that we would bring it to the HSAC and put it out to you all. So I'm going to be quiet and let you just jump in and talk about what you shared in your groups.
Rosalind Davis from CYC. We were a group of 2. I had the mental health SMA in my group. It was just she and I. And we both came to the conclusion that one of the very important pieces after using the data is reaching the parents and being able to try and reach them where they are and helping them understand the importance of the need, whether it's mental health. And for me, it's health around the physicals and especially the dental and the dental treatments. So that was both the conclusion that we both came to, is being able to reach those parents and help them understand the importance and taking it from there.
Thank you, Rosalind. Good to see you.
Good to see you, Miss B.
So this is Joshua Krasny from ARCAD. In my particular group, it was first of all, it was very clear that we're utilizing different assessment tools, and those assessment tools obviously range from assessing the needs of the parents versus assessing the needs of the child and how they may run concurrent. What was understood pretty much across the board is that the increase in need has risen exponentially. And we contributed that to 3 primary factors. The first being pre-COVID, a kiddo may have been too young at that point where we weren't necessarily recognizing those red flags. Whereas 2 years later, we are now seeing those red flags. The second being the time that a parent has spent with their child over the past 2 years. In the event that there is an older sibling, they might be recognizing that that kiddo is not necessarily meeting their developmental milestones like their sibling did. So that's giving a parent potential insight much sooner than they might have otherwise already had. And then the third being is, what is obvious to all of us is the regression that so many of our students have undergone, and the social emotional component attached to that, having not been in the classroom for the past 2 years. So, again, while we talked about assessments, the conversation really did veer much more so towards need and capacity.
Did you guys discuss any ways that you were finding that the agency was able to provide that support or to help kind of minimize those gaps as children are moving through their program?
No, I think it became more of like a venting session.
Yeah, it's a huge problem. You're 100% right. It's one of those ones that it is so tough.
Yeah.
Like we can all see it, but it's such a systemic, wide-ranging problem.
Yeah.
And sometimes those vent sessions are really, really needed.
Very much so.
Everyone I think, is so stressed out and so tired right now.
So one of the things, thank you, Josh and Shelby. One of the things that we talked about in our session is the difference between all of these various meetings that we have, not only with one another, but with parents. And so, Deb, you can help me out here. You would use one term and I would use staffing, because that's what I relate to when we go back we would staff and sit down. And I think it was like every Friday, we made time to sit with the group, the site director, the FSW, the teacher, the disability coordinator. We would all sit together and individualize for every child. And we called it a staffing. Deb, did you want to add to that?
I think that's a great recap of something I used to do when I was an ed coordinator for a Head Start program, but we called it something different. We called it family child reviews. And what we did was we had the entire support team. We were lucky enough to have a nurse, the family support manager, the teacher, and myself and our disability coordinator. We would staff children on a regular basis and to come up with an individualized plan, not only for the child, but for the family, and then talk about what resources we would share, whether it be with the family, whether it be with the babysitter, because maybe the babysitter was taking care of the child the majority of the time. And we found it really helpful. I think the one thing that really stays with me around reviewing children or having staffings on children is that you get to hear from each one of the different disciplines what they're observing and seeing as a way to come up with a comprehensive plan and see how, for example, we had a child who the teacher wanted to make a referral because of some social emotional issues. But then during the family child review, it was revealed the child flunked their hearing screening. And hearing has such an impact on social emotional language literacy. So I think reviewing children and families on a regular, consistent basis, we found so valuable. And not just reviewing children when there was a problem, but reviewing every child and every family on a regular, consistent basis. And then reviewing those children who we needed to refer, maybe on a faster schedule, a schedule that maybe they were once every 2 weeks, where maybe a family and child, where there were no particular concerns, reviewing them once a month or every other month. So similar to what you did, B, but we did it we called it something different. Staffings were when we referred a child. Reviews is when we talked about every child, every family as a way to come up with a particular plan.
Mm-hmm. And then one of the individuals in our group, I think from CYC, also mentioned that they have various different staffing meetings. And so, you know, as you mentioned, Deb, there may be one meeting that they get together to just look at the whole child. And then there may be another one that's specific for referral for evaluation. And maybe another one that they have to call for. So we were just interested in picking our delegate agencies' brains to see how often they meet or are able to meet or are able to plan to meet, because we know it's difficult on individual children, because it really does take everyone's expertise, everyone's discipline to really look at a child and try and come up with what may be going on. The other piece to this is the family. That's the very important piece. Children live within the context of their family. And so if mother and father are dealing with situations that have nothing to do with the child's curriculum or learning. It really does. Because what is the family experiencing? And so that's also a good time at that review or staffing for the FSW to say what they know and what they know about that family and what needs to be worked on. Because if you're looking for housing, you're not really as concerned about a hearing issue. That overrides and prioritizes. So just wanted to engage you a little bit. And if there was anything that we may have missed or anyone wants to bring up, please feel free.
Ms. B, this is Rosalind. So it seems that we have a lot around the child. And would it be a possibility of starting to focus once the child has been identified, then how are we going to reach the parent and help that parent and guide them through the process of what they need in order to be successful to help the child?
Yes, and I'm glad you brought that up, Rosalind, because agencies are doing just that. And that's why these meetings are so good, and the subcommittee meetings that you all will be having. And the reason why we felt it was important to open those subcommittee meetings up, because you can't do one without the other. You can't service the child without focusing on the family, and vice versa. So this will be the type of discussions that I'm sure you all will have coming up in those subcommittee meetings. And then we get to be able to figure out what we need to prioritize and what we want to begin to solve for. So if there are a number of families that are undergoing the same concerns in their community area, then we have all of these wonderful SMEs and expertise of the delegate agencies in the way some of you have solved certain issues. So we will be looking to engage you in these subcommittees. And don't forget, we have parents that are part of our HSAC and our HSAC subcommittees. And so they really enlighten us as well. All right, with that, I am going to turn it back over to Dr. Sally. And thank you all for your participation. Dr. Sally. Dr. Sally, are you unmuted?
Yes, I'm here. I don't know this. I'm going from screen to screen. Oh, well, I want to thank everyone, good engagement, good participation, lots and lots of information. And the irony of it is that the things we hear today, we hear also at other meetings, but each time we hear it, it's like it's coming in with a new twist. So encourage us to use what's available. Thank you to all the SMEs for the continued work that we're doing. And delegate agencies, we want you to utilize every single opportunity that is available to make your goals also achievable. Thank you to everyone that made the presentation today. And we value your time together, partnering in this commission will be able to make a difference, not just in the city of Chicago, but also surrounding. So I thank everyone for participating, engagement, and we'll look forward to seeing us again. In the meantime, the subcommittees, let's also look at the dates so we can send it out to B to help us organize the meetings, the dental education, family, community, disability, the health. We'll be sending out the date for our subcommittee meetings so we can also look at those data that are coming out there to utilize it. So I want to thank everyone. You've been awesome, awesome. This is time you pat yourself on the back. I know B can do it from online, but pat yourself on the back, and we thank you for always participating when this meeting is called. We have A whole lot of participants on here today, about 42. That's a good turnout. So with that, we're closing the meeting now, and we look forward to the next one. Everyone have a blessed week, and God bless you all.
Have